Hi, everyone. Today we will be presenting a topic on how the COVID-19 pandemic impacted underserved areas in regards to malnutrition. COVID-19 was the beginning of a new era for all of us in the world. In one way or another, people were affected by the pandemic. Some people struggled with their mental health, physical activity, and some struggled to get food on their plate. During the pandemic, the world saw a rise in food prices and rates of unemployment skyrocket. The pandemic made it increasingly hard for some people to feed their families, and a lack of food is linked to malnutrition. Malnutrition occurs when the body doesn't get adequate nutrients or minerals that your body needs to function properly. There are many complications that come along with being malnourished, which will be later discussed. The pandemic did not just affect people with the COVID-19 virus, it affected people who suffer from malnourishment. According to a study done by Nadu Gilani, the cost of food, groceries, and household items increased by up to 63%. COVID-19 made it harder for companies to find workers and transport items to get them into grocery stores. The companies were then forced to pay more money to get the products into grocery stores, and with the lack of workers and higher transport costs, led to the drastic increase in prices that we saw. According to the website Center on Budget and Policy Priorities, the unemployment rate jumped to 4.9%, which was a level that has not been seen since the 1930s. 4.9% might not seem like a very high number, but it was high enough to create problems for a large amount of the population in the US. In the US alone, there were 4.2 million jobs lost, and most jobs lost during the pandemic were from industries that pay low average wages. This drastically affected low-income communities and made it extremely hard for them to get access to basic resources. For certain individuals who lost their jobs, government aid was granted, but a list of criteria had to be met. But for those who did not meet those financial requirements, they are left without any support to feed their families. In the US alone, 20 million people were left hungry and without any food.
Due to the measures taken to respond to COVID-19, such as physical distancing, school closures, trade restrictions, and country lockdowns, there was a major impact on food systems by disrupting the production, transportation, and sale of nutritious, fresh, and affordable foods, forcing millions of families to rely on nutrient-poor alternatives. In result of this, more children became malnourished due to the worsening quality of their diets, interruptions in nutrition and other essential services, as well as the socio-economic shocks created by the pandemic. When looking at specific countries that were hit the hardest in relation to malnutrition due to COVID, poor countries such as Yemen, Congo, and Haiti were at top of the list. Many poor people around the world suffered the most because they didn't have enough income to buy fresh, nutritious foods and prepare good meals for their families. In the US, for example, many lost their jobs and were laid off of work, making it very difficult to generate income and make good meals for their families. We will watch this video from YouTube that looks at how COVID-19 brought food insecurity for many, specifically certain groups who were more affected during the pandemic than others, such as African Americans, Latino and Hispanics, and Native Americans.
African Americans are now 3.2 times more likely to be food insecure in this country than whites. Hispanics and Latinos are 2.5 times more likely to be food insecure than whites. Native Americans continue to be 3 times more likely to be food insecure than whites. So what we saw was that this pandemic exacerbated a challenge that was already there.
Malnutrition during the pandemic. The good news for malnutrition, if there is any, is that from 1990 to 2020, the number of children under 5 years old suffering from chronic malnutrition actually decreased from 253 million children to 144 million children. But the bad news is that because of the pandemic, we saw malnutrition actually reverse and rise for the first time in 3 decades, back to 149 million. So we actually saw 5 million more children suffer from malnutrition during the pandemic than before in 2019. On that note, 150 million more people were affected by hunger and inching closer to malnutrition than before. So they weren't malnourished, but they definitely had food insecurities. Consequences of COVID on malnutrition. The consequences of COVID-19 on malnutrition was an overall disaster for people who suffered from malnutrition, were affected by hunger, or suffered from food insecurity. As you already know, COVID-19 caused people to lose their jobs and income because they either had to lock down, their business shut down, or they had fears of COVID. This loss of income was exacerbated for people who were already suffering of malnutrition, as they had now even less ways of getting themselves and their families fed. For example, a taxi driver driving a cab in a rural part of a third world country might no longer have an income and be able to support himself and his family. How will his family get fed? The lockdowns hurt supply chains globally and caused prices to rise and the availability of food to become more scarce in certain areas. This combination was a perfect recipe for malnourishment. Malnourished children, particularly those with severe acute malnutrition, have a higher risk of death from common childhood illnesses. Moreover, malnourished people were more likely to get COVID-19 more severely. Yet with a strained healthcare system, these people might not want to seek healthcare services due to the fear of getting COVID or because the capacity is already full. And this can have a long-term health effect on these people and their health. So it's not going to be immediate and we won't see it right away. As we saw in this slide and the last, these consequences result in an additional average of 5 million children suffering from malnutrition as compared to before the pandemic. This video should help highlight some of these realities and consequences.
Salwa is 5 years old, but weighs the same as a newborn baby. In Yemen, her agony is nothing unusual. UNICEF says 2.4 million kids could be malnourished by the end of this year. A war long ignored by much of the world, now made worse by the challenges of a pandemic.
It was a massive problem anyway in a country like Yemen, but now there are going to be so many people needing assistance and needing help.
Hunger had been worsened in recent years by conflict and climate. Many of the people at risk this year are in countries where food is not normally an issue.
It's the fact that if you're a poor, hard-working taxi driver in an urban slum somewhere and you can't go out to work, you won't get paid, you won't be able to feed your family.
In India, internal migrant workers suddenly had to rely on donations when the country went into lockdown.
You are probably asking yourselves, how did this happen? There are many reasons that malnutrition and hunger spiked during the pandemic. While the pandemic played out, we were so occupied with treating those with the COVID-19 virus and following the guidelines in place to reduce the spread of the virus, which caused most of us to forget about the silent killer, malnutrition. It was not on the top of government's priority list, which is why so many people suffered because of it. If an individual was suffering due to malnourishment, the odds of them getting medical attention were very slim. Someone could be suffering from malnourishment for months during the pandemic without getting any assistance from a doctor. Those who lost their jobs were receiving little to no income. They still had to pay for everyday necessities. Although there were government aid programs in place for people who had lost their jobs, those who had to work during the pandemic had to pay for food alongside the rising food prices while keeping the same salary that they had before. Food banks were available to low-income households, but the surge in monthly users of food banks rose greatly, making demand for food banks much higher. Their ability to meet demand plummeted due to the difficulties in sourcing and distributing food. With this increasing demand also required an increase in volunteers, which can be incredibly difficult to find in a period of self-isolation and social distancing. A lack of government intervention during the pandemic created devastating long-term consequences for children, human capital, and national economies. So how can we prevent this in the future? Unfortunately, there will always be populations of low income, but we can reduce the risk of malnutrition by changing some of the mistakes we made during our first COVID-19 pandemic. According to Four and his colleagues on an article they published on child malnutrition during the COVID-19 pandemic, protecting food producers, processors, and retailers, discouraging trade bans, and designing food markets to be essential services and keeping them functioning and safe for workers and consumers are the first steps in protecting children from malnutrition in the future. Access to food for low-income households through an adequate and reliable financial program is needed to reduce gaps in the distribution of food to those who need it most. A guaranteed income would not only reduce these gaps and inefficiencies in the government support, but it would also provide adequate income to all Canadians to purchase food. Experts, including leading food bank operators, agree that this is a much more efficient, comprehensive, and resilient approach than trying to prop up the emergency food sectors. Let's hope that the government will implement better strategies for future pandemics so that we can all live with our bellies full. Thank you.